Okay, so hello and welcome to everybody watching today, Marge members, midwives, and others. I'd like to say hello and welcome, and I want to say that today we're incredibly lucky to be joined by someone whose work has been transformative for so many in the Ehlers-Danlos and neurodivergent communities. Jane Green MBE is a highly respected specialist advocate and thought leader in Ehlers-Danlos hypermobility spectrum disorders and neurodivergence. A former specialist teacher, trainer, and autism advisor with lived experience of both autism and EDS, Jane brings not only clinical and academic insight, but a deep understanding of the real life challenges people face navigating health systems. She is also the founder of SEDS Connective, an award-winning social enterprise supporting people who are hypermobile, neurodivergent, or both. Her mission is to make invisible conditions visible and to change the way we talk about health, identity, and care. So please join me in welcoming Jane Green. So we'll pretend there's an audience and maybe I can clap in the background. But thank you so much for joining me, Jane. It's a
Thank
pleasure
you
to
for
see
having
you.
me.
That's okay. It's a pleasure to see you again. Um, some people may know actually that we've kind of co-hosted, no, co-participated maybe back in the
Yes,
pandemic. It
yes, a
was,
long time ago. Yeah,
yeah, it was Academy by Chloe Farahar.
yeah.
Yeah, that was a lovely little glimmer of um, hope and research and people getting together when we weren't allowed to go out. So that was a lovely time. So yes, it's not the first time we've spoken, but it's the first time that I've approached you to help us out as a chair of Marge. So thank you so much, and I really appreciate your time. So the reason I've asked you along is a lot of our midwives, researchers, and allies, people interested in helping neurodivergent people access more equitable and better maternity care. Some of them, maybe actually a lot of them, are aware that hypermobility, EDS, and other connective tissue disorders are highly relevant to maternity care, perinatal care, and postpartum care for autistic people and neurodivergent people. So this is why we've asked you along, because as a leading expert, we believe that asking you some of the questions we're going to ask today can really have an impact. Um, so what I'm going to do, I'm going to start with general understanding of what things are. So we're going to start from the foundations, and then as we go on with the questions, we're going to look at things like self-advocacy, holistic well-being, but also more practical things for midwives practicing today and other professionals. Is Are you all prepped and ready to go and lend us your brain?
I don't know if I am, but I'll do my best.
I'm sure your best is going to be amazing regardless. So we'll start with a general understanding of Ehlers-Danlos or hypermobile joint syndrome. So for those new to this area, how would you describe Ehlers-Danlos syndrome and hypermobility spectrum disorders in clear, plain English terms?
Yeah, I'm going to do it very clear because yeah, I can talk about this for a long time. We use symptomatic hypermobility because a lot of people do not get a diagnosis, but Ehlers-Danlos and the closely related HSD, which you've just said, they're connective tissue disorders and they're multisystemic. So, top to bottom, throughout the system. So it affects all the systems in the body, as well as the joints, which we know about, like,
Mhm.
being double jointed, doing these party tricks, which I tend to
Mm.
move my hands a lot, by the way. Um, but also it affects the gastrointestinal tract and the head and everything. And the connective tissue, it seems to be the key, one of the, at the moment, the key issues, and it's collagen, which we've all heard of when, you do your skin
Mhm.
and you buy creams and things like that. It's got collagen in, it's great.
Mm.
Uh, but our collagen is extra stretchy and probably, I mean, I haven't seen it under a microscope, but I think it's looser and more stretchy, but that means it's weaker. And
Okay.
I suppose you could do I usually do an analogy to house in my longer talks, and this connective tissue, as I said, is found near the organs, near the lymphatic system, vascular system, so and the brain. So it is quite multi-systemic, and I think the problem has been in the past thinking it's just double jointedness, and of
Mm-hmm.
course not everybody is. And there are 13 types of named EDS.
13. Wow. Okay.
13. There is a 14th actually, but it's unnamed. Don't know why, but it hasn't been christened yet. But there are 13 named types, and 12 of them extremely rare. And one of the ones maternity and midwives need to know about is obviously vascular EDS, which is can be life limiting. So, but usually you would be diagnosed with that younger, and um, it is heritable, but mainly genetic. So you can genetically test for vascular EDS. It can cause aneurysms, bleeding, and affect the heart. So that's quite a significant thing. And then the most the next, I think that's very rare. That's like 1 in 40, 50,000. By the way, I'm not medical, and I do sound medical sometimes, I know. And the other is most common we have in our group is, but it rare, is classical EDS. But the most common of all is something called hypermobility Ehlers-Danlos, and that's probably about 90% of our members have that,
Wow.
or the
Okay.
closely related hypermobility spectrum disorder as it is at the moment. And these it's been around. People have mentioned it since 400 BC, but it's taken
Wow.
a long, long time to get there. Not Ehlers-Danlos, but laxity in joints and poor wound healing is key. Um, but in 2017, the International Consortium changed the nosology, so the criteria. And
Hmm.
so hypermobility Ehlers-Danlos came in. I might go off track, so you're just going to have to keep. I do have ADHD as well and other things. Multiple neurodivergent, by the way, so I might go off because I find it always interesting. And but there were classifications before. So when I was diagnosed finally in 2015, I was called. I had EDS3, so they had numbers before that. Um, and they change it as slightly, and then that's for adults, by the way, and for children you have something else called pediatric types. So you have pediatric generalized joint hypermobility or pediatric generalized HSD, and you don't diagnose before the age of 5 because the bones haven't formed maturity, and you can diagnose maybe at 13, it depending on the bone maturity, but generally at 18 or when the bone structure is mature. Yeah,
That's all really, really helpful because I think when someone presents for a booking in or later on, the changes in the terminology, depending on at what point in their in their lives that they were diagnosed, what time, in relation to diagnostic criteria and so on, these will be relevant to what someone is reporting, whether they have a formal diagnosis or maybe they remember something from childhood that
exactly.
doesn't
Yeah.
quite click. So, knowing the history of it is really going to help um, pick up
Yes,
those things, I
because
think.
the actual criteria for it is based on generalized joint hypermobility. So you have to have what we call a Baton score or scale,
Yes,
and
yeah,
that varies with age. But of course, as you age, you often get stiffer, and we get more injuries, or particularly people with hypermobility. So they actually get worse, stiffer than flexible, but they might remember when they were a child doing all these party tricks and
yes,
things.
yeah, absolutely. And the hormones that come with pregnancy, as we'll discuss later, this may be the first time that some symptoms are reappearing, or maybe they're feeling more empowered in their health. Anyway, sorry, I'm going off on a tangent now. So we've got, all these different terms in the timeline of these diagnoses. But these, it may lend itself to discussing now. why is it so often delayed? So what is the literature? What are the community saying? What are people reporting as reasons why a diagnosis can be so delayed in women, trans and non-binary people, and neurodivergent people?
Oh, well, there are a number of reasons. It could be historically, medically, research bias, male bias, because
Hmm.
the funders maybe were male. I'm just saying this, the research was generally done by males, and it seems to affect more girls, women, or trans. So because of the hormones, and I mean, I do come across some even autistic, lovely, lovely men. They're 6'2", and they say, I can touch my feet, the floor, with my straight legs. And I'm hypermobile and I don't have any problems. And I go, good, that's lovely, but that doesn't mean we don't. And I think, sometimes we've not been believed, even in our own communities, or diagnostically misattributed to some of the issues we have. I've
So
forgotten the
what
other
are some
part
of
of your
those
question.
common,
Mm.
sorry, what are some of those common misdiagnoses? What could have what could people have been mistakenly told in the past?
Um, Well, often I do look at historical dramas and think, neurotic woman in a corset, fainting and looking really ill, probably had POTS and hyper, because they often get
Yeah,
hypermobility. Sorry, POTS is postural tachycardia, orthostatic tachycardia syndrome, and
thank you
part
for
of
that.
dysautonomia. So often frail and neurotic, or just weak, or hypochondriac comes up. But otherwise, the usual diagnoses we get, and including myself, were irritable bowel syndrome, chronic fatigue syndrome. Some people get ME. I was diagnosed with CFS, so it depends where you are.
Which is
And
chronic fatigue syndrome, and I'm not going to attempt to pronounce
no, I nor am
myo-encard.
I, because I can't pronounce things
People
that
people
well.
can use Google, that's fine. I'm sure saying that badly in a Welsh accent is far too much of a barrier for the listeners.
Or English,
Sorry.
in my case, is just as bad, I'm sure. And then, of course, fibromyalgia, which is a diagnosis, and I do have it. But of course, it's a bit like seeing a piece of, a grain of sand in the beach. I think it's
I like
part
that
of the whole.
analogy. So
I was trying to think of a
fibromyalgia,
pebble, but I couldn't think of a pebble. Pebble on the beach maybe is
pebble
better.
or sand can work. Yeah, I see it. So with fibromyalgia is, I think, quite commonly misunderstood, misinterpreted the term because, I mean, literally, doesn't it mean
Oh,
like muscle
goodness.
pain, like generalized muscle pain? That's what the Latin is, isn't it? Or
I'm
am I
so sorry,
wrong?
my phone went. Sorry.
Sorry, so fibromyalgia being something that could be misdiagnosed instead of a type of hypermobility.
Well, the thing is, fibromyalgia very easy to diagnose. A GP, a doctor can
Mm,
do it. Other people can do it because it's a very simple thing to diagnose, and it doesn't take a lot of time. So when you've got a GP appointment, they don't have a lot of time. We know that it's really difficult to get an
yes, of
appointment.
course, yeah.
So sadly, hypermobility is very complex to do it properly. It takes much longer, and of course the doctors aren't trained in it particularly. It used to be that you were referred to a rheumatologist, and I might have to say something about that later on. Yes, so I mean, the I can't, I do have pronunciation things sometimes that you wouldn't believe it because I talk all the time.
Mm.
Fibromyalgia and IBS actually is probably, it is irritable bowel, but again, it's like that grain of sand in the beach. It actually is part of
Not seeing
something
the whole
else.
picture,
Yeah.
not
And
understanding
that's
the.
what I find so fascinating about this. Honestly, the minute I saw this, I understood it even back then.
Mm.
Uh, uh, um, and I had ideas about it before. I just thought this is just mind blowing, and that's what people find as well. Um, yeah. So I think those are the most common diagnoses. I'm thinking of all the members. It's for the eating issues, they often, particularly children, and I'm being careful here because ARFID does exist. My eldest child had ARFID, but I know when I couldn't eat, and I was a middle-aged woman, and many others, because of interoception and proprioception and cognitive emotional understanding of pain, and also having to mask being labeled a hypochondriac, because that happens all the time, and being neurotic. I think, but obviously children don't. I think sometimes we learn to accept what we're told, that we're being sensory eaters, or we're being fussy eaters. I think with children, if they can't articulate or express the issues they have, and understanding it's painful, I mean, it's what I would do is like push it away. Don't want to eat it. That's painful.
Mm.
And so we know that a lot of our members do have something called gastroparesis, which is it can be half or full paralysis of the stomach and so on, and bowel and bladder issues. But they're often, oh, you're autistic, so you must have an eating disorder. And I'm not saying there is that as well, but you've got to rule things out. And then you've got other diagnoses like, some people get F&D, which is functional neurological disorder. And but we would recommend that EDS or hypermobility is completely ruled out before giving that.
Okay, so thank you. That was a really thorough look at history and potential misdiagnoses, and what some of the misunderstandings and barriers to a timely diagnosis could be. Thank you so much. So one of the questions we've had in from one of the members is specifically around EDS and being neurodivergent. So the question being, can someone have EDS, HJS? Sorry, I'm
It's
struggling
fine.
to remember the
But
acronym.
just say hypermobility. It's
So
fine.
can someone have hypermobility without being neurodivergent and vice versa? How do presentations differ, if at all, across different neurotypes? Is that something that you've come across?
Um, well, as I said, with men, you can be non-symptomatic. Some people are non-symptomatic have non-symptomatic hypermobility, and if you've got a lot of support, and you do a lot of say you're doing a lot of sport when you're younger, which often happens. So you might be a gymnast, a dancer, a swimmer, a run. Some people are very good at the dancing and so on, and you get all that strengthening. That's really good. But once they get an injury, or they retire, or they might have a family, that's when the issues come. So they might not have known about it before, particularly. I mean, I'm talking about younger than me, because the older generation, we didn't have the science or the
Yeah.
words for it. So of course, um, we didn't have that support. And I'm just trying to remember the question. Can you
So
be
the question,
neurodivergent without?
yeah, so basically, because we know there is a common overlap between hypermobility and neurodivergence, we know about that Venn diagram, but can you have hypermobility and these other connective tissue disorders and not be neurodivergent, and vice
Well,
versa?
so the statistics say that given EDS in particular, that was because it's very hard to screen for all the
Yes.
different
Yeah.
things, and GGH. You're 74% more likely to be autistic. This was in 2016, and 56% ADHD. Now, and then other studies have done separate little bits, which seem, again, they're adding up to that beach. I'm very
Yeah.
visual, by the way. I'm seeing the beach with grains on. So the 2022 Kazakh study found that you're more than double likely, if you've got connective tissue differences, i.e. joint hypermobility, to be neurodivergent. And in that, this is what we particularly focus on, is autism, ADHD, dyspraxia, and Tourette's. And you're more likely to have pain and fatigue and dizziness than the general population. And then there are graphs on there with the girls only about 80%.
Wow.
So,
Okay.
so as the studies, the evidence, and there are lots of little ones around there,
Yes.
lots of ones, because it's a whole body, and if you add them all up, they're adding up with my beach. I keep going to the
Yes.
beach. I've got a
Yes.
beach. I need to see a beach. Have you got beach?
I can see one from my son's bedroom window.
Oh,
So we're lucky enough where we live, sidetrack, but I've got a mountain on one side of the house and we can see the beach on the other. We're very
oh,
lucky, very
I'll
lucky.
come and visit you.
Oh, that would be lush, as we say around here. So, sorry. So what you said about, with women, girls, or non-male, you're seeing high proportions of neurodivergence and hypermobility,
They might not have a diagnosis, of course, and
but they may have symptoms of pain and other
pain,
fibromyalgia.
fatigue, brain fog,
Mm.
anxiety. Um, that's a key one. Yeah, temperature issues, allergies, by the way.
This is building up a really useful picture because my next question was going to be,
Mm.
what are some of the most common challenges that people with these disorders may face during pregnancy, birth, and postpartum? So you've covered quite a few of them: anxiety, fibromyalgia, joint pain, fatigue,
Well,
brain
when I
fog.
talk about anxiety, I don't mean mental anxiety though. I'm talking about
Okay.
physiological anxiety. So, what happens is the vascular system, which I talked about before,
Hmm.
is weaker. And so generally, and this generally happens, this is why 13 to 55, because of hormones. It, the collagen is weaker in here, and as you get up from, from being prone to sitting up, the blood will start pooling down into the feet because it's not as strong. And then you go to stand up in particular and you get very dizzy, you get brain fogged, you get, oh, where am I? And if you're unlucky, you have syncope, which is when you faint, and low blood pressure or high blood pressure, depending on the type. And what that means is your heart, which is clever, as you know, will think, oh, we've got to start pumping the oxygen to the brain. It's not doing well. And so it starts pounding really, really strongly. It's really a horrible feeling, and it makes you feel uneasy. You start shallow breathing. You start might look a bit sweaty and sort of fainty, but sort of shaky almost.
Mm.
And to anyone else looking, say, oh, they're autistic, they're anxious. It's actually a physiological issue, and that's what it's called anxiety. And I actually don't like the word anxiety at all anyway, because I think the physiological anxiety is fine, but other anxiety should be more like stress. And I find the anxiety is like snow. The Eskimos have 52 words for it. We've just got this one, and it doesn't work. So that's why people don't understand the physiological anxiety. And of course, it affects brain fog. So that's why we get the brain fog and executive functioning issues.
So what may to an observer, maybe a midwife, without this knowledge, may be perceiving is, or they're, like you said, they're just autistic, they're just a bit anxious, but is it
And
full
they might be
body?
anxious, of course, yeah.
Yes,
And
yeah, of
having
course.
a baby and changing is change. It's change, isn't it? So,
Yes.
that's scary. But I think usually if they've got postural tachycardia, they might have been diagnosed when they were younger, not always, but you can also get orthostatic intolerance, and that's without. So basically when you're an adult, POTS, which I'm going to call it now, is when you stand up for after 10 minutes, your heart goes up at least by 30 beats. I think it was 30 beats, and I think
Wow,
children is
okay.
40. But with orthostatic intolerance, it actually goes down. So that's what I've always had. And so I go dizzy and I have really, really low blood pressure. So the blood pressure is really key. And we often find people have really low blood pressure, except for POTS, which can go extremely high. And extremely worrying, I presume, because it can go to about 180, over something, which is different from the others where it goes really low to about 60.
That's really interesting. I'm seeing some parallels where a lot of psychologists and clinicians, not that I agree with this, but they often say that neurodevelopmental disorders, including autism, often lie in the extremes. Now, that's a whole other thing that I could.
Actually, I agree with that. I
But I
do.
would say that, well, at this specific instance of blood pressure,
Mm.
it does EDS will lie in the extremes.
I think hypermobility does. The
Mm.
presentations we have as members, I'm one extreme, people have the other. So talk about skin, which is
Mm.
obviously very key for maternity as well. Some people have got
Yes.
very thick, almost silky skin and are accused of looking younger than they are quite a lot, and don't really have those character lines and so on. That's a bonus, I suppose. But the other people have very translucent skin, very hard to get a vein. So you need butterfly clips in, so that you get what we used to do webinars. You've got the wobbly, moving invisible veins. They seem to move away from the needle,
Whoa.
and and they bruise. They can burst very quickly. So this poor patient has all these awful bruises all up and down the arms, and so on, and sometimes further. So. Whereas people like me, the other time, you give it a needle, oh, bush, here's the blood, and it'll come out like bush. So
So it's
we're
in the
quite, that's what
extremes
I
for
mean, we're
taking blood
extreme.
as well. Yeah.
Yeah.
So it's in the extremes for taking blood, for blood pressure, for
I think a lot
sitting
of
and
our
standing.
presentations are quite extreme. Yeah.
Yeah. Fascinating stuff. So we've touched on quite a few examples there of things that will be visible or at least reportable in a midwifery appointment. So the bruising, the blood
They
pressure.
might not know, of course, they might not
No.
understand it. So a lot of people don't understand it, some might. And often they don't know why the bruises have appeared. And,
Mm.
that's an issue in itself,
But
of
speaking
course.
speaking to midwives specifically, if we are building that picture where there's lots of grains of sand that are starting to build this beach,
Yeah.
that is definitely, so there's a few of them there. So, more specifically about things that can happen in labour as well. So what has your research or your community anecdotally reported differences in labour? So things like labour positioning, contractions, um, postpartum recovery. Does it look different?
Yeah, well, number one, just before we get there, is the musculoskeletal frame is different. So we've got
Right.
laxity in the ligaments. Often they get, is it symphysis pubis and all the sacroiliac joint pain. So often
Mm.
they need braces and supports. But yeah, they can get very uncomfortable. And of course, with loose connective tissue, they might not hold the baby in the same way. In fact, I'm pretty sure I did a poll once, and because I'm like that. Um, do
Same.
you have a tilted womb? Now,
Okay.
yeah, and the reason is I had this inkling that we do,
Right.
because of the connective tissue. I know from my experience for my children, and it caused issues. And it was amazing how many people knew they had a tilted womb. Yeah,
So what kind of
and so
stats were you looking at then when you did that poll?
I did. It was our own poll. It was a
Yeah.
SEDS Connective one, but it was amazing, and
Wow.
we took it further. And I'd love to do more, but I have this. So yes, I'm going to go back to extremes. Some of the research has always found that we have very short, shorter pregnancies and shorter labour, and preterm, but again in another poll, we found the other side that they actually went further along, much further along, and much longer, and they had to be induced, and then blah, and then blah, and blah, blah,
So it's in
and
the
so
extremes again. That's
again
fast.
the
Yeah.
extremes, and I think actually, I mean, I have my own beliefs, but there isn't a lot of
Hmm.
research yet. But I do think connective tissue can affect the outcome of the baby if it's
In
not
what
known.
sense?
Well, epidurals don't always work with us. We know that anesthetically. So
Yes,
we
I've
know
read.
that locals can, or about 50% do not work with us because of the lidocaine is lighter. We need heavier ones. We also know because of the laxity. So when having an epidural in the back, the laxity of everything there means it just doesn't work. I have been there, and we don't know why. Well, they never knew why, and
Mm.
I think there are a lot of issues to look at. I'm not saying it's huge, but anecdotally from our members, a lot of
Yeah.
them have those issues. And of course, wound healing, we have, although some of the, on the surface, we might have fine, sorry, we might heal fine, it's underneath we don't. And so that can be an issue as well. And then our pain, the cognitive understanding of pain, because we mask pain. We've been told we're hypochondriacs, so we don't know, or we've been in pain all our lives. Some people have been, extremely ill
Yes.
all their
Yeah.
lives and really don't understand pain. So we did some work on that years ago, and we described it like a firecracker wrapped up in barbed wire on fire, to describe it rather than the first scale.
I
So,
sort of what a mental image, but it
oh,
gets the
sorry,
point. No, it gets the point
I'm very
across.
visual.
No, it's useful. Um, so I can't stop thinking about now, relating to something I've done in the past. So in the second year of my master's on autism and related conditions at Swansea, we were tasked with doing a systematic review. And I chose the autistic pain experience because, again, like many of the topics, it's born from personal experience and wanting to understand my neurology and physiology more. What I found, this is very, like, probably problematically reductionist. But just to gloss over, what it found is that in terms of tactile touch, we are more likely, so in terms of getting the needle in, touching someone, especially on skin that has vellus hairs, there's certain types of skin where we are far more sensitive to touch and pain. However, with by us in this instance, I mean autistic people, but in terms of interoceptive pain, which labour contractions could be one of them, the pain tolerance is far higher. And then that's before you even get to differences in pain communication.
It's interesting. I went to a couple of conferences recently. And, pain is the one thing that connects the whole body. Well, I think hypermobility does. I would probably challenge that slightly,
Hmm.
but I think we vary interoceptively. Some people are very aware. I mean, I've been involved in studies on this, so I kind of know. And so we're very aware of our bodies, and some people do not have that at all. But I think the pain just suddenly comes out the blue, and it's worrying. And for the touch, yeah, there were talks on that, and how, in fact, they did it for. I will show you the paper. They have these for prenatal births, babies. They had this sort of rippling blanket that sort of soothed, like it was still in the womb. I'll try and
Oh,
find that
wow.
that study for you. It was very interesting. I think it's on YouTube. Anyway, and they were showing how touching the skin in a, like a bit like massage is very therapeutic. It's
Mm,
very, once you can do it, if you can do it and you don't have allodynia, it's very therapeutic. It's soothing and it's like that. But of course, when you're in pain, you don't want that sort of thing at all, or thing. I
yeah.
think the first touch you feel might be very painful, but if you keep doing it, it often desensitizes. That's what I found, but I'm not
Yeah.
sure. I'm not a pain. We've got pain advisors. I'd have to ask them.
I'd love to talk to those because I like my research was very limited and I was a student and it was 2017. So I'd love to run in again in a professional, a more advanced, more experienced
Mm.
capacity. But it was an interesting snapshot of research at the time rather than something that I take to be, a blanket statement and proof. Um, so yeah, a lot of what you've said, it like a lot of things lying in the extremes, a lot of barriers to accurate diagnosis. You've got gender disparities as well. It's a really, this grain of sand in the picture. It is a huge, huge topic.
I think it is absolutely huge, and I'm sadly it can cause issues with babies,
Yes,
a lot.
I was going to ask a little bit more about that. So when you say, do you mean like APGAR scores or
Well, sadly, even, if you're not aware of the issues with,
mm,
say, oxygen, I know you are as midwives, but with our connective tissue, it does cause a lot of issues. We call it, if you can't connect the issues, think connective tissues. It's not my saying, that one. We put it in quotes. No one knows the origin. But so for example, we can get, I think that's why a lot of learning disability occurs with autism, because of these issues with birth. And that's my own opinion, but it's what I've seen. I've experienced it myself personally. But I'm lucky, some people don't have their children with them anymore, their babies, because of this. And so there are issues like that. Mm.
so birth trauma and additional complications or disabilities for children is something that you've been seeing anecdotally in the population?
Yeah, yeah, and myself personally. And I
Yeah.
think after birth, um, often you might need wounds. It depends if you've
Mm.
had cesarean or natural, of course. Um, but very often the baby might not be able to suck, so the reflexes, sorry, not, are not there. And in my day, we used to go to childbirth classes and all that, and you do this and you do that. Nothing sort of followed the book. You're meant to do. My eldest could not do it. Could not do it at all.
So that's
And
something that midwives could look out for as well. So if an expectant mother has been to a class and things don't ring true to their experience, and difficulty feeding as well as another thing to add to this huge checklist.
yeah, I think again, it's my second one latched on and never stopped eating and still hasn't, and he's 6'4". So maybe they are extreme. Although my eldest did have a lot of issues from birth, so that might be the key thing.
Okay.
The other thing to look out for, I suppose, is after birth. If you're going to ask that, have I pre-questioned? Have I? You might have allergies. So
Okay.
yeah, if you are giving if they can't and they're given bottled food, you need to look at the lactose, particularly because eczema is a very, very key indicator here, and we tend to find babies have the seborrheic dermatitis and the eczema, and then they what's the word, they don't what's the word when you don't, sorry, I can't, it's late, I've been talking a lot. You don't develop as the developmental milestones, but
Failure to
they often
thrive.
can't digest. So they actually, I know they lose weight after birth, but they lose a lot, and it's a
Right.
concern, the bowel and bladder, and they often are screaming a lot because of the pain,
Oof.
and we don't know that. And then they have the other issues probably.
So that will be something for any health visitors to look out for as well. But bringing it back to midwives there, you said about allergies. Are the mothers going to be likely to report more issues with allergies too? Or if they're unaware, what
Don't
could they
know. They
be?
might not be aware.
Mm,
That's the thing. It might not be aware. So they might have IBS. That's a key
hmm
indicator. Uh, or they might not. They might have had eczema as a child, or they might have rhinitis, hay fever, pseudo asthma. So all those are in a sort of family, and then you might get things like wheals and rashes, which come on the skin, erythema on the skin, itchy wheals. They're not eczema. They're sort of, they can be fluid filled. Um, you can get something called dermographic. See, I can't say it
Derm
today.
I
I'm
can't
so
pronounce
sorry.
it either, but I know what you mean because the
Skin
graphia is
writing,
writing,
skin
skin
writing.
writing. Yeah,
They
yeah.
can write my name on when and that's when your histamine is quite high.
Mm.
So you have a lot of inflammation, basically, is what I'm trying to say. This is the whole thing because of the connective tissue and over, I wouldn't call it over vigilance, but the amygdala in the brain is sensing threat from the body's sensing threat. You have inflammation. The inflammation makes you more tired, and it's just becomes a sort of a bigger thing. it's like the pebble on the grain on the thing.
Mhm.
It becomes a whole circle, and
And
it's hard to
that's
get out.
before you add the issue of pregnancy as well. I would call it an issue. It's not an
Well,
issue. I'm sure somebody would correct me, but specifically looking at the vascular type, when you've got such an increased
uh,
blood flow in pregnancy.
that would be very, very monitored. If you've got vets, I'm sure
Okay,
they've got a care pathway.
okay.
So that's okay.
That
But
was my next.
yeah, no, they would. So they would be looked at for that. That would be key. Yeah.
So for the more populated group of those with hypermobile types, um, what would you advise for those individuals in terms of seeking assessment, support, or reliable information? If this video, they're either watching themselves or their midwife has signposted this video or learned something from this, what would be the best way of, reaching out for an assessment, support, and, changing how they're cared for?
To get a hypermobility Ehlers-Danlos
Yes,
or
if they suspect that a lot of what they've heard from this video rings true.
normally I would say you go and see your GP, you take a list of symptoms, your
Hmm.
family history, what you were like before. To get a hypermobility Ehlers-Danlos one, you need to have a sibling or direct member in the family to have a diagnosis too, which is quite hard
Mm,
if you're older,
yeah.
um, and it's going to be harder again at the moment. So, and if you are diagnosed with a pediatric type, you have to be re-diagnosed at 18.
Okay.
Um, and that's why we use symptomatic hypermobility. We don't require that. Uh, However, in fact, we're just doing a conference. So for this, uh, rheumatologists are probably not going to accept referrals from now on for
Oh,
this.
right. Okay. How
Mm.
was that announced?
Well,
Oh,
they've
is it just
decided.
through the grapevine kind of thing?
Well, no, this has been sort of announced.
Okay.
I'm don't. It will be we're finding members are getting referrals, and that's why we're doing this long COVID conference. By the way, post COVID-19 have very familiar symptoms to us. We are very familiar
Oh.
with them, like the chronic fatigue, like
Mm.
the other ones. So if you've had an infection, um, uh, could be bacteria, it could be an injury, an accident. We have people with car accidents, it sets it off. And then you get all these symptoms or virus, it probably means that you've got different connective tissue. And so one study found that if you've got this different connective tissue, i.e. joint hypermobility, which is the Baton underscore, you're 30% less likely to recover from post-COVID-19, what we used to call long COVID.
Wow.
That's why we're doing the conference.
Very much needed, and
Yeah.
that's quite a sad. Sad is a
Yeah.
very is
Well,
not the right
we
word,
used
isn't
to
it?
have things called glandular fever,
Yes.
Epstein-Barr, all these sort of things. I'm not saying they don't exist. They do. I had scarlet fever. It's just that maybe the catalyst
Mm.
to the connective tissue kicking off. Who knows?
Very interesting, and that will, depending on the level of detail that an expectant mother can give about their history, that is one of the many interesting bits of insight that could let a midwife maybe start to question that there may be this multi-system issue going on. So in terms of, I'm going to use the analogy here of waving a magic wand. So a midwife has um, a newly pregnant mum who has started to feel changes in her body and started to resonate with some of the symptoms we've talked about today that makes her wonder, hey, maybe I've got this hypermobility issue. What would you advise? So we've discussed some of the ways and barriers to an assessment and a diagnosis. So what can a midwife be best placed to do in this situation to help and support someone?
I would just like to say not everyone, suffers like, some of the extremes I
Yes,
put.
of
Some
course.
people
Yeah.
do very well. And I always like to say that because I don't want to be doom and gloom, but it's
Mm.
about support, knowledge, and understanding. So I would definitely say put them in touch with us. And I'm sure there are other groups, but we do have a growing group of health advisors actually. Um, the musculoskeletal issues will be probably key. So
Yes.
they often need a pelvis or back brace and understanding how to move, because proprioception, that being clumsy, is difficult enough sometimes, not all the time, but with definitely being pregnant, it probably is more so. And then you've got our diet fads, going on that. I just want to say, though, I think one study found that people with POTS actually improved during pregnancy, weirdly. Yeah.
Okay.
But I'm not saying it's all, but I did see one study that you actually
Interesting.
improve. But also I think you might be more. I know some are more likely to get what I've forgotten. Yeah, diabetes, some sort of pregnancy diabetes as well. I'm not sure.
Gestational diabetes.
Uh, but I don't know, and I'm not a medical
No,
researcher.
and neither of us are. But again, we're aware of the research, and what we're doing is we're painting a picture of the
Mhm.
landscape and the information available, rather than dictate. We're not in a position to dictate what care pathways should look like, but we have more information at our fingertips.
What I would say, and it wasn't in my day. In my day, you put your feet up, you eat double, and you knit. Well, I can't knit. I did eat
Wow.
double. Yeah, I'm that old. But strength is key. Movement is key for us. Absolutely strength, and to keep it, to us together as strong as you can. I'm not saying you suddenly start doing marathons when you're pregnant, but you just keep going as something. You do
So
keep
not to
doing something.
discontinue what was normal exercise,
Well, you might have to get
potentially.
special
Yeah.
pregnancy ones, but they've got to know about hypermobility. And there are people out there, or there are some good ones, on the social media, some good ones, some not so good. Um, and ideally, if you're doing something anyway, I presume, well, unless it's horse riding or I
Yes.
don't
Yeah.
know,
Yeah.
catapulting, it's okay. Um,
But
because
specifically to these conditions, maintaining strength is really important, is what you're saying.
Yeah, and and you, of course, sorry, I'm gonna move. The vascular system often leads to more varicose veins, sadly, because of the weakness. That's we tend to see
Okay.
that.
Okay. Fascinating stuff.
And also swelling. Oh, sorry, I'm adding to it on so you get more swelling in the lower limbs as well. And
I'm kind
usually
of
the
glad.
lower limbs really start there.
I'm kind of glad that I
Syndrome.
haven't kept a list, because this is huge. When you started
We
us
have
off.
graphics for it, and
Oh,
people say you
okay.
didn't put. Oh yeah, we're quite well known for our graphics. They go all around the world, and people say you didn't put that on and didn't put that. And I thought, if I put all of those on, we're never going to stop. So I've put the most common ones and what they're often seen as in children or adults.
That's brilliant. So I could probably signpost that on the website underneath this video, if you wouldn't mind. Um,
Yeah,
because again, we've discussed so much in the past hour, but I think what we started with is generally what we're going to tie things up with, it, as well as the statement that the understanding needs to be that it is multi-systemic. It's not just
it
looking
is
and being a
multi,
bit bendy.
but they might be fine. And I just want to do that. But I think the actual labor needs to be just understood that they might have tilted wombs. I don't know what the
Hmm.
proper word is for that. They might not take the anesthetics as well. Their blood pressure might be all over the place. They might not know if they're in pain or not. And they might be extreme in the ways they do it. So, and often, I mean, I don't know, but I presume some people have very strong contractions and some people don't. And some babies will move a lot all the time, 100% kicking and doing, and other babies they have will not be moving at all. And maybe that's their character when they come out. I'm not quite sure. Um, yeah, so
So
it
in the extremes again, then that seems to be
I,
the
I,
theme for the
I,
day.
I just, I'd love to do more on this. I'm quite busy, but I'd love to be involved or get our members involved. I don't see many maternity ones. I have been asked to, something might be coming up. Um, and I absolutely am. I'm sure that the hormones are key here, and
Mm,
the connective tissue, and it is probably the proteins in the collagen and the extracellular matrix which are key there, and the blood-brain barrier.
fascinating. Well, I wish I could wave a magic wand in this instance and give you funding and an army of researchers to help you achieve the change. But in terms of what you've done today, I cannot thank you enough for the information you've provided. It has been an hour jam-packed of information, but information that is fully contextualized and full of human story that people can remember. Because it's difficult to remember the list
Yeah,
of possible symptoms, but things like the grain of sand in the bigger picture and finding extremes in observations. Um, it's been an absolute pleasure in discussing this with you, and I can't wait to get up on the website and see what people think. But hopefully this isn't a goodbye.
oh,
Hopefully, I know you're a busy woman, but I will definitely be signposting people to SEDS Connective. And I hope that we can do something again in the future. I've got a feeling our midwives will want to ask even more specific questions of you. I'm sorry.
I think I'm doing a conference next year in
Oh.
Wales, actually.
Oh, well, Marge members are everywhere, but if you want to come over for a cup of tea, please do.
Oh yeah, beach. Yes. Okay, thank you.
There we are. Okay. So on that note again, thank you so much for your time and your expertise and the lovely way in which you've delivered all this amazing information to us. Thank you on behalf of Marge. Thank you.
Thank you for having me. Bye
That's
bye.
okay. Bye.